Hey guys, what is up, OT geniuses? Welcome to another Mentorship Monday. Today I have a treat for you. I have Dr. Carol Lambdin on, and I'm going to be bringing her on, and we're going to get this show started. I hope that you guys enjoy what she has to say. Hey, Jenny, how are you? Thank you so much for joining. Today's setting that we're going to be talking about is the mental health setting. And Dr. Lambdin was actually a professor of mine when I was an OT student. So, yes, enjoy, guys. And I'm going to bring her on right now. Speak. Hello, Dr. Lambdin.
Hello, how are you?
I am well. How about yourself?
I am doing very well. Thank you so much.
Guys, so Dr. Landman is amazing, and she right now could be with her family or just doing anything else, but she is taking time to drop some knowledge on the mental health setting. A few weeks back, I put a post just wanting to see what settings you guys wanted to learn more about, and I saw that that was one of them. So I hope that you guys enjoy what she has to say. And so, yeah, Dr. Lambdin, can you tell us a little bit about how did you end up teaching mental health? And tell us a little bit about your OT journey.
Ooh, okay. And it's been a long journey. I got a really kind of late start. My undergraduate is in theater, and
Wow.
yeah, who knew, right?
I
Uh,
actually I did not know that little tidbit.
but I was always a very good role player, if you notice, right? Um, so I came to it actually in my early 30s. So when I graduated from undergrad, I said, I kind of realized that, I don't want to, the only place that you really can go is either LA or New York in terms of kind of a healthy theater career. And I just didn't think I had uh, the degree of resilience that it takes to get years and years and years of rejection before you potentially make it. So long story short, I just really I drifted, and I actually fell into healthcare. Got a job as a activity therapist in a nursing home.
Very
And
cool.
yeah, so I did that. I did that for a couple of years, doing groups all day long, and then ended up at a brain injury facility. So started to and was in and around occupational therapists, implementing some of their behavioral programs. So I got kind of a taste of that. And then from there, I ended up working in a residential facility for older adults living with mental health challenges. And I did that for about 6 years, doing 4 therapeutic groups a day. And so at that point, I said, I think I'm doing what an OT does, but I really don't have the theory base. I mean, I know what I'm doing is working, but I don't know why. And so I'm probably one of the first people in history, OT history, that went to school just to get the theoretical background to, understand why what I was doing was working.
That's so funny.
It is kind of funny, and I really wanted to just go back there and continue to work. And when I graduated, they said, "Oh, I'm sorry, you're overqualified, and we're not going to, keep you here." So, and I graduated in '99 when the caps went on. So at that point, you could only do. I mean, OT kind of lucked out, but in PT and speech were kind of lumped together. But at that point, you really couldn't bill a whole lot for yearly services cumulatively. So long story short, I graduated when there were no jobs to be had, not in mental health, not anywhere. Most of my class remained jobless for about a year. And so it was a really, really difficult time in the history of OT. And I actually ended up doing some physical disability stuff, going back and forth between assisted living facilities, and within the year realized that, mental health is my thing. I thought I might want to break and just say, I want black and white for a while. I'm tired of the gray. I want to go home and not think about it. And I just, what drew me to everybody that I treated from a physical disability perspective was their narrative, was their story, was their, their emotional wellness, their mental wellness. And I just said, I'm trying to fit a square peg into a round hole. Mental health is my heart. It's my love. And that's what I need to be doing. So
that's why I wanted to invite you too.
So yes, you must do what you love. You have to. So I ended up, again, there were no mental health jobs, and still, to this day are very few. But so I ended up doing something a little bit out of the box, in that I was the director of a clubhouse. So if anybody gets into school, hopefully you'll learn a little bit about the clubhouse model. But it is a program. I shouldn't say it's a program. It is like a club, if you will, for people based on a work order day for individuals with mental health challenges. So I was the program director. So I really got to really infuse occupational therapy in everything I did, and kind of put that out there as a lens with which to view these individuals and to be able to support them towards greater health and wellness. And then very shortly after I graduated, because I had so much kind of mental health experience and knowledge under my belt, they FIU, our program,
Go Panthers,
Go Panthers, asked me to adjunct teach for them. And that really started my kind of career path in academia. So I adjuncted for many years there, and concurrently did different things in mental health. Consulted, did direct care provision, got some programs started where they had OT, OTs working in mental health. So kind of did the ebb and flow of the whole salmon swimming upstream. But that's my lot in life, and that's okay. And so hopefully I've jazzed a lot of people along the way about mental health.
What I love about, though, what you're sharing is that it just comes to show that just your career, one's career, really, not just specifically yours, but one's career is usually not linear, and one's success is not necessarily linear. I think that as students, we just have this idea of, this is what I want to do, this is what I want to do. And we can lose focus of the different settings or the different things that are available to us. And if, honestly, how going a different direction can even be a blessing, So, yeah, you even started off, like, guys, if you're watching, like, and you're just catching it now, she was a theater major, which is, yeah, like, you don't need to be also you need the prerequisites, obviously, to get into OT school. Right. But one of the most common questions I get is, what should I major in? So I love that, you're just following your passions and doing your thing. I think that's so cool.
Thank you. And two things to add to that. One is that students are always asking, what do I do for field work? I've got to have the perfect placement. And I say to them, listen, you've got 50 years of working ahead of you. This is 6 months of your life. Even the worst field work can be the best learning opportunity ever. So it will be what it needs to be. And of course we'd like a phenomenal experience, but every experience is phenomenal. It's all about perspective taking. So, don't put so many eggs in that basket of getting the perfect fieldwork experience, because it just doesn't exist. That's right. Number one. And then also, as a former chair of the admissions committee, as well as I'm currently a member of another admissions committee, personally, I look for, I'm not saying I, am biased towards people from, that are outside of, let's say, health sciences or kines or anything like that. But I think it's wonderful to have a holistic, my cord is going everywhere. That we can do double Dutch here. Anyway,
I'll join you.
There you go. But it's so important to have a well-rounded cohort, So I love to see students coming from kines, coming from health sciences, coming from psychology, coming from theater, coming from archaeology. I mean, it just doesn't matter, because all of those things, even the outside of the box things, create such a rich cohort. And we need that diversity in occupational therapy. So I don't know that there's like this one, one
Right.
or two kind of, undergrad major that are the golden ticket into the profession.
Yeah.
I think a lot of programs actually look for some other programs that are outside of the box.
Which as we were prepping, I actually just realized that I never got to bring this up to you, that I got an email from a student today, now that you were talking about this, and it was a very heartbreaking email. She's currently a student in a OT program, so she's been admitted and going through it, first year student, and she was saying how she's failing kines as a first year student, and now her field work is getting postponed, and how it's taking an emotional toll on her, as well as a toll on her mental health. And so I am sure too that there are some students maybe struggling with the fact that maybe they failed a prerequisite course, or they're dealing with the rejection of a program that they really wanted to get admitted to, and they really are struggling with, it's taking a toll on them emotionally and mentally. And I don't know what advice you would want to give to those students.
So kines and neuro, I've been teaching for 20 years, and probably every cohort, those are probably two of the most difficult things to get through. So this person and many other students are certainly not alone. It's challenging. And if your mind doesn't necessarily work in those ways, rote memory is not my forte. I'm a big person, big picture, conceptual kind of gal, which is maybe why I'm more drawn to mental health, because I, try and memorize all the muscles of the upper extremity just wasn't my forte, isn't to this day. Okay. And so but that doesn't necessarily mean that there isn't a place for you in occupational therapy. And yes,
Right.
do we all need to get through it? Of course we do. Do we all need to have certainly a decent understanding of how the body works? Of course we do. But the most important thing is that we use that not as the be all and end all, but just a way to understand occupation, because that ultimately is the heart of everything that we do. And
Right.
so, there are certainly areas where, that kind of knowledge won't necessarily be at the forefront of your daily operations. So, I would suggest, get a tutor, get other people in the program that are successful in terms of kines or neuro or whatever you're struggling with. Figure out where the mismatch is, because that's what we do as OTs. What's not working for you? Is it the content, or is it really just the way that you're trying to learn it? Maybe you're a visual learner and you need to map it out visually, and just seeing words or listening to a lecture isn't going to do it for you. Lectures for me were in one ear and out the other. I had to
Me
see
too.
it. I had to feel it. I had to make it come to life somehow for me to be able to get it.
I also told her too that another thing that I would suggest is even also, getting people in her corner, that understand the
Mm-hmm.
struggle,
Mm-hmm. Mm-hmm.
that are not going to either judge her or like
Right.
make her feel also incompetent.
Mm-hmm.
So,
Mm-hmm.
yeah, I think that would be also my advice to those students that are struggling with something of that sort, and
And
doing what you're saying as well, for sure. That's
and
so
like
critical.
and like you said earlier, I mean, okay, so this person perhaps is held back a little bit. Um, you know, things, I mean, I'm a firm believer in things happen for a reason. Again, we don't always know what that necessarily is now, but I've seen, and it's devastating. At the time, I've seen people held back a whole year, because they didn't pass something. And at the time, of course, it was devastating, it was difficult, it was challenging. But to a person, every one of them. It was eventually a blessing in disguise. These individuals became some of the best OTs you could ever hope to have. And they just needed to cook a little longer or learn a different lesson or learn something new about themselves. And so, as you said earlier, school isn't linear, recovery is not linear, life
Hmm.
is not linear. And the sooner that we can wrap our heads around that, and I understand that it involves, more money and this and that kind of thing, but this is life. This is the journey of life. Enjoy it while you're on it, because, we may never pass this way again. So embrace all of it. How can you know success if you haven't known failure?
Yep,
So
it's true.
it's all good stuff. Yeah.
Um,
And
s-
definitely rally people around you that
yeah,
will be empathetic to
I
what
think
you're
that's
going through.
so critical.
So critical.
What would you say makes working in mental health different from other settings?
I read that question and I thought, my first inclination was, well, it's not different, because if we're all focusing on occupation, then
It's
is it
true.
really different? Should it be,
And
theoretically,
yeah,
should it be any different from any other setting? Okay. So in theory, no, it really shouldn't be, because if we're all focused on occupation, then occupations are something that people, many occupations people have in common. That being said, ultimately, yeah, we are more, focused on the things that socially, emotionally, cognitively, psychologically prevent you from participating in the things that you need, want, or are expected to do. So that focus shifts a little bit, although as a holistic practitioner, it's still my job to recognize the things that physically are preventing you from being, if I'm always in pain, whether I have anxiety or depression or schizophrenia or not, that pain impacts me mentally. It impacts me emotionally. So while I may not necessarily directly treat that, I need to recognize that. So, and the same is true for any setting. Even if you're in a, hand therapy setting, you should be recognizing what's going on mentally and emotionally with that individual.
we're
Again,
holistic.
we're holistic. That's right. We're holistic practitioner. So whether you feel qualified to necessarily or in that context can treat that directly is a separate issue. But the fact that you're able to recognize it makes us very unique. Um, you know, I would argue that folks that in this country, because of the stigma and because of the way that we view mental health in this country, that there really isn't true parity in terms of reimbursement for physical and mental health issues, that these very often, unless it's a private pay situation, are some of the most underserved and marginalized individuals that you could potentially come across as a practitioner. What does that mean? That means that, you have to be really on point with your skills, and certainly your people skills. I mean, mental health setting will make you become more empathetic, I think. Certainly will make you hopefully become much more intentional about your presence in the world and how you impact other people, and even with a look that you can impact somebody. Um, and also being able to really adapt and be flexible in the moment, because all of your decisions are based on what you're getting from the other person, what they've
Right.
said, how they've moved, how they looked at you. So it can be a very challenging setting, but ultimately there's never a dull moment. There's never the same day twice. You get to be unbelievably creative. You get to really listen to and understand people's narratives. It's
Yeah.
just such an amazing practice area. I can't say enough about it, obviously, but I'm biased. So.
Eh, yeah, I think you're gonna love this story. So, some of you guys watching may know that I work in an inpatient rehab facility. So, I basically see people for various neurological disorders to musculoskeletal disorders if they come for like a hip replacement or a total knee replacement, stuff of that sort. I actually the other day got this one particular gentleman, and I noticed that he was very upset, and it reminded me of what you were saying, that mental health is in everything, whether you're in ortho, or whether you are in an inpatient rehab setting like me, because this patient got told the night before that he was going to get his foot amputated.
Oh
And
my gosh. Ugh.
yes. So,
Mm.
like I was like the rest of my session was focused on that and coping skills and mechanisms that can, see can basically help him uh, problem solve ways for him to emotionally handle the stress and everything that comes along with that. And but
Hmm.
um, guys, this when you're dealing with something like that, it takes an emotional toll and a you know a, even a spiritual toll.
Oh yeah, for
So
sure. And usually that's
I
what
just
people, I was going to say, usually that's what people, I mean, that's what they struggle with the most, is making sense of how they're going to experience the world in a different way now. And that, and if they're already at risk for a mental illness, predisposed, high, risk factors, social determinants of health, then, are you still hearing me? Are we okay? Yes? Okay, good. Uh-oh, I can't hear you though. Oh, wait, I heard you a little bit.
there.
Oh, there you go. It's something to do
Okay,
with your
cool.
speaker. There you go, your headphones.
Okay.
Then, yeah, regardless of setting, people typically don't come to OT um, because everything is fine. They're coming to OT because they're in a predicament. I mean, it's unfortunate. We really need to put a lot more emphasis on keeping people well, as opposed to treating people after they've already, I would like to say, after they've already fallen in the river. But ultimately, people are very vulnerable and very fragile. And so you need to be able to really pick up if somebody is really at risk for a mental health challenge because of whatever they're going through at the moment. Okay, I can't hear you. Okay,
Okay.
yeah, it's something with your headphones.
Headphones. Hello.
Yes, yeah, they're good.
Yes.
Oh, yeah, stop moving them. Okay, no, they're back off again. It comes in and out. Okay, don't
Hello.
move. Yep, don't move.
Okay. Okay. I won't move.
Okay.
All right. So, okay, I was gonna ask, what are some of the biggest challenges that mental health is currently facing that you've
Uh,
noticed?
well, I think nationwide we're really in a mental health crisis here. I mean, you can see it in terms of the upticks in school shootings. I'm going to argue that ultimately people are becoming more and more disconnected from one another, and that really impacts their mental and emotional well-being and spiritual well-being, as you said. Um, we've reached critical mass. So again, if you're already predisposed, social determinants of health, then we're really looking at having a a crisis on our hands, and we are. We have an opioid crisis. So we as OTs, I think there's a real challenge for us as occupational therapists to get back into, push the doors open, in terms of mental health. I think the opportunities will be there because there aren't enough mental health practitioners right now, whether it's psychologists or social workers, to really handle everything that's going on. So I think the time is really right for us to push that door back open and get back into mental health in a really meaningful way. That's one challenge. Um, it's interesting. Most of the literature, you would think, oh, mental health, I'll get burnout, compassion fatigue. Believe it or not, mental health clinicians are less likely to experience burnout and compassion fatigue because you have to be so in the moment. you have to be present, which really requires you to be very mindful. And when you're mindful, you tend to be more relaxed. And so we actually don't experience as much compassion fatigue as other
That's an
practitioners and other,
interesting
yeah. Mm-hmm.
statistic.
Mm-hmm. Yeah.
I did not
So,
know that.
yeah.
Which actually is a perfect segue to my next question is why should a pre-OT OT student consider mental health?
Well, certainly the need is there. It's such a rewarding practice area because oftentimes you really can get to occupation. There are some settings, and when I say that, what do I mean? I mean that healthcare and productivity standards are the antithesis of client-centered care. I think we can all agree on that. The
Yeah.
more,
Yes.
right. Now we're moving from volume to value, but the implications of that are yet to be seen. Okay. But ultimately, when you're forced by the system, and it is a business, to be more and more productive, it cuts down on the quality of care. There's just no doubt about that. The relationships that you can create are minimized. So,
Mm.
I think that by and large, in many settings, especially more non-traditional and community-based settings in mental health, you get more time to really work with people. You get to go out and actually do their occupations. They
Yeah.
have parties. They go to work. They participate in groups. They sell things. They have ADLs, all IADLs, instrumental activities of daily living. And you get to be out there where people live and work and play, which is very much where we are needed and where we should be, because the hospital or those kinds of settings are not reflective of where people live and work and play and love and hope and dream. That's not,
I
it's really not in
I
concert
feel
with
limited
occupation,
in that. In my job, I feel limited to what I can do because of that.
yeah,
To a certain
yeah,
extent.
and
Obviously, I can
right,
help, and I'm impacting them in one way or another, and it's great to see them being able to do ADLs again and all that
right.
stuff. But it's not their home.
Right. You get as
It's
creative
not.
as you can, right? But
Yeah,
it's not where they live, work, play, hope, dream, love, pray, all that good stuff. So I think it's a really
yeah,
wonderful, the time is ripe. And I think that is particularly here in the US, people were crying for it. People are just so disconnected, and the rates of anxiety, even among OT students, are through the roof. And that's statistically, panning out in terms of this particular generation that, anxiety's up, depression's up. I'm anecdotally seeing more and more of it in cohorts. And
mm.
so, we need to address this, or
This is why you guys
forget a
should get into
crisis.
mental
It's
health.
forget a crisis. It's going to be a tsunami that we're not going to be able to. I mean, I don't mean to sound catastrophic, but it's going to be a tsunami that it's going to be difficult to come back from as a
Ay,
nation,
ay, ay.
psychologically. So, there's a
Yeah.
lot of great work to be done. And there's so, if you can dream it and you can do it. I mean, that's my firm belief. I've always made a way in mental health when there really was no way. It wasn't always easy, but I surrounded, and there were days when I just said, God, I want an easier road. And that lasted for about an hour, and I'd have a pity party. And then, I'd get back and say, no, if I'm the only person out here, then that's the work I'm meant to do, and I'm going to do it.
That is so just amazing. I definitely feel your passion for this setting and just for the profession.
Thank you.
Um, so as we close, what advice do you have for our students watching? What
Um,
advice would you
well,
give them?
well, first of all, this is wonderful to have a platform. When I went to school, I was clueless. Clueless. I mean, this was before the internet. before getting connected, I would highly recommend that find mentors. And that does, you know, just because you hear somebody once doesn't mean that they necessarily are going to make a great mentor. But find people that you connect to. Find your tribe, as you say. Find people who support you, who don't judge you, who encourage you to be creative, encourage you to think out of the box, and follow your passion. You know, I understand that student debt these days is a mind blower. However, you know, and if you can, you know, withstand a setting for a couple of years and make a ton of bank to pay off those loans, and you can survive that, even though you don't like the setting, great. But I would argue you're in this for the long haul. Find what you're passionate about, and it might take you a while to find that. Yeah, because you will burn out. There's no amount of money. You come into this world with nothing, you're going to go out with nothing. I hate to tell you that. You're going to go out with nothing. You know what I mean? You can't take it with you, right? This is, I mean, I guess you could Tutankhamun try to take it with him. I don't know if he did or not. Things were still in the tomb, so I'm guessing not. But you might as enjoy the journey. Enjoy the journey. And you might make mistakes, and that's okay. Well, nobody's perfect. We're all human beings, and if you don't like a practice area, then you take a risk and you get another one. Don't be afraid to take a risk.
I love
and
it.
Just and be passionate, and please feel free to share my information with anybody if they think they're interested in mental health. I love to hear from people.
Dr. Lambdin is a part of the group, so I'll be tagging her in this video.
Awesome.
If you guys have any questions for her, please feel free to message her or me, and we'll try to answer your questions to the best of our abilities.
Awesome.
So,
yay!
well, thank you again, Dr. Lambdin. It seems like
thank you.
We got a lot of comments. I don't know if you can see the comments on your side, but we got some people saying this is great advice. This is phenomenal. All these little hearts.
I'll pay you later. I'll pay you later.
So,
thank you. I'm very passionate about it, and please reach out. Yeah, thank you. Please reach out. Glad you enjoyed it.
All right. Have a great evening.
All right. Bye, Jazz. Thanks.